Dear friends, good evening to you all. I am Dr. Arun, consultant gastroenterologist and hepatologist, practicing myself mainly in Apollo Hospitals, Greens Road, Chennai. Today I am here to discuss with you all regarding irritable bowel syndrome. What do you mean by IBS? This entity is very common for most of the patient who is going to have a visit to the gastroenterologist. Because if you are going to land up with this kind of presentation, you may experience varied symptoms. For example, most of the patient who is going to develop irritable bowel syndrome, they will be having vague abdominal pain. The bowel movements will not be good. The intestinal system of the patient fails to function normally. So they may experience frequent bowel movements. They may sit in the toilet for more than 4 times, 5 times, and some patient may experience evidence of constipation for more than 2 to 3 days. And some patients will be experiencing vague abdominal pain. So this syndrome is going to create so much of annoying event to the patient, in which it turns to the gastroenterologist for the final opinion. Once the patient turns towards us, we are going to do a basic investigations to you. We need to identify the precipitating factor for this irritable bowel syndrome. What are the various precipitating factors if you are going to be overweight for your age, and if you are going to lead a sedentary lifestyle, if you are not going to do good physical activity regularly, in case if you are going to be overstressed, if you are not getting good sleep in right time, and if you are going to eat plenty of junk foods. So these are all the various precipitating factors are there. If you are going to be an alcoholic, if you are going to be a smoker, in case we are going to land up with uncontrolled diabetes, in case if you are going to have a long-standing thyroid-related problems, there are so many etiological factors, precipitating factors to look into this feature of irritable bowel syndrome. So you need to control your weight and do good physical activity, avoid your stress, sleep well, and make sure that your diet should contain an equal proportion of a good amount of fiber, and avoid junk foods, avoid carbonated beverages, avoid highly sweetened beverages. All those things you need to take care to overcome this complication successfully in your life. So take care of your irritable bowel syndrome. In case if you are having this kind of presentation, for example, the alarming events, if you are going to have a blood in motion, if you are going to develop a mass in your tummy, these are all the various presentation which will create an alarming event. Most of the time a patient who is having irritable bowel syndrome will not experience these events. So always you need to be cautious, you need to look into the alarming picture, and as a counsel to you, a good physical activity and avoidance of stress will overcome all the complications successfully. Thanking you all for patient listening.